I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. What happens when we get to spend time on the Seaworthy podcast with somebody who is on the leading edge of the wave in their space? Today, we are so fortunate to be joined by Dr. Anna Cabeca, who is a triple board certified doctor in obstetrics and gynecology, an author, a lecturer, a podcast host, and so many other things. And most importantly, a defining element in how we think about the importance of women's health, menopause, a healthy relationship to it. Dr. Anna, thanks so much for your time today and welcome to the Seaworthy podcast.
Oh, I'm thrilled to be here with you. Thank you for having me. And I love how you start out, and I'm really honored to be here. And part of my mission has been to empower the individual to be completely in ownership of their best health. So here to help.
Well, we have, given that our service missions have some parallels philosophically, that creates a pretty neat energy to meet in. And as we got ready for today's show, I shared with you that a person who has given me the privilege of being on my email list sent me something recently and said, "Hey, Dr. Rob, thanks for what you're doing. And humbly, you need to do more in this space and you need to interview Dr. Anna."
Well, I love that. That's awesome.
So I hope she checks this episode out. And the gist of her message was so compelling. And I think it's a pretty reverent place to start, in that women's health and the health of the world are entwined. And respect for women and honoring them is a defining aspect of the health of our culture. And then menopause specifically is a defining aspect of whether or not we're supporting women's agency and empowerment. And so this woman's email invoked the importance of a clear definition between why to do hormonal replacement therapy, what's the difference between bioidentical and conventional, what's the duration of treatment, with the implication being that lifelong treatment can be important for women. She invoked progesterone as being a necessity, even in a woman who's had uterus removed, a hysterectomy. And then for my own part, I always do a very careful assessment of women's breast cancer risk and having them know the 1 in 9 lifetime prevalence of breast cancer, independent of the safety of bioidentical HRT. And so I think today, if we can just spend time knowing that people can check you out more and all of your extensive resources and programs if they want to benefit from your wealth of wisdom. But if we can talk about what you think is most important in those domains, positioned where you are on the leading edge of the wave and defining the leading edge of the wave, I think that'll just be a super high yield podcast.
Well, thank you. I think that it's so important to understand there's been so many misconceptions about bioidentical or hormone therapy. And even recently in June, research was published saying that women on hormone therapy actually had an increased risk of Alzheimer's disease. And we're like, whoa, at least we thought that was the one good thing, right? Well, we know the progestins are the ones to blame. And so there's so much confusion. So first, clarifying, all hormone therapies are not created equal. We know this now. There's been the HERS trial and the WHI study. Both of those really illustrated the catastrophe of synthetic progestins in the human female body, for sure. And so we should be taking those out of the equation completely, but yet they're still part of normal prescribing patterns. They're part of every birth control pill, every combination hormone therapy that's not bioidentical. And it is detrimental. I mean, there's very rare, if any, reason I would use those synthetic progestins. The exception would be if I had a patient that was heavy bleeding and I'd had her on bioidentical progesterone and wasn't able to get it, then I would put her on a short course of Provera or synthetic progestin. So very like, that's like not even a fraction of a 1% of my patient needs. So that's the first thing. Not all hormone therapies are created equal. And then, bioidentical hormone therapy, in the right sense, not too much, not too little, works really well for our entire lives. And as women, owning that and owning, okay, well, when do we feel we need more? When do we feel we need less? When do we even need to take a break? I mean, is that just that statement in of itself is mind blowing to patients? What you mean? I really have autonomy in this? I really have, a say in this, and that blows their mind. But yes, sometimes we need more, sometimes we need less, and being able to figure that out because we know our bodies better than anyone. And if we can trust our bodies again, that makes a difference versus giving our power away to a prescription pad, a drug, or even another physician like me. What I want to instill is that you know your body, you understand your body, and you speak up for your body. And that's part of the ownership I like people to have.
A lot of my patients are blown away when we talk about agency and body intelligence, and it's so refreshing to them because I think it resonates with the deep wisdom they have about their bodies and what they need, and that's part of what they've been so thirsty for in their healthcare setting. I know this is so nuts and bolts for you, but how does a woman decide now, knowing what you know, whether or not to even consider it? So one consideration is the risks. Given, and correct me if I'm wrong, but given on average about a 1 in 9 lifetime prevalence of breast cancer, and then of course nowadays these women get back a tissue sample if they have breast cancer, and it tells them if the tumor is listening to estrogen or listening to progesterone, the estrogen receptor status. How do women decide to even undertake that journey? And then what can you share with our listeners, who I thank for joining us, with the implications of not choosing bioidentical HRT, given the things you and I know about longevity, radiant vitality, bone density protection, etc.? How should one even frame the consideration
Of hormone therapy? I mean,
yeah?
it's such a good question. If we look at the blue zones, right? They're not on hormone therapy. They're
Mhm,
just not. They're living
mhm,
quality of life. They're living quality of relationships, a positive attitude, a good amount of time outside or socializing. So that is better than anything I can write on a prescription pad. And I say this in my first book, which is called The Hormone Fix, that it takes more than hormones to fix our hormones. And it's so true. The lifestyle pieces, understanding, nutrition and what we're eating, how we're nourishing our body, not just what we're eating, but when we're eating it, who we're eating with, when we stop eating, when we start eating, all of those factors, how well we're chewing our food, I mean, goes beyond the food themselves. So like in and of itself, that is really where the true empowerment comes from, is that we don't need an outside source. And with that said, I'll probably be on my bioidentical progesterone cream balance till I die. I mean, like that is one that I doubt I will let go of, right? And it has progesterone and pregnenolone in it because I've had stress and trauma. I'm sure many people listening have in their life as well, going through stressful times. And that tends to deplete progesterone, which is one of our mother hormones. And so I use progesterone pregnenolone cream. It's my balance cream, and I use that. And that is works for women with and without a uterus. And that's another big myth about hormone replacement, is that if you don't have a uterus, you don't need progesterone. Well, that's not true. You definitely don't need a progestin, a synthetic, but bioidentical progesterone is probably what your body needed and was deficient in, that caused you the need for a hysterectomy to begin with, possibly. So with or without a uterus, progesterone helps the brain, the bone, mental function, all of those pieces.
mm, mm. Oh, this is so great. I love what you're sharing. And I'm really blown away because Montana and Alaska have been remote settings for me. And so this time I get to spend with you today, this is where I get to meet my tribe. So it's really
Because you can
cool.
feel like an outcast, I bet.
Well, because it's a choice I made where I've loved living. I get to Montana and Alaska have so much connection to Mother Earth, which I think is another part of our health
For sure.
that's been an indispensable resource for me. And and maybe it makes this sweeter, right? That could sound like playing Pollyanna, but my patients and audience may have gotten tired of hearing me say this, but I don't think it can be stated frequently enough or nor overstated. We can't supplement our way out of a lifestyle deficit, and we can't prescribe our way out of a lifestyle deficit.
That's so true. That is so true. I see it every day to the point in working with my patients. Like if you are unwilling to change this behavior or meet me halfway, and it could be something like such negative self-talk. If you're unwilling to focus on one good thing about yourself on a daily basis, nothing, you can spend thousands of dollars with me, but it's not going to help you.
Yeah.
So
Yeah,
it's something like that. Those things, it's like, we want true health. Listen.
yeah. Yeah, well, let's drill down into that a little because I have one piece of good news I'd like to share that I've learned from my patients and just uh, 18 years in functional medicine now, 17 years, is that folks think when we ask them to engage lifestyle, they think we're asking them to live like a monk or an Olympic athlete. But I have found that it's the lifestyle engagement uh, as a qualitative change, not a quantitative change, that makes the difference. It's leaning in, it's being curious, it's reinventing breakfast as chia pudding, or one positive thought per day, or one Polaroid of that person well up on the peanut board of their consciousness, or one bite of each color of fruit or vegetable daily. That seems to it makes me think more and more the transformation has to do about the quality of how people make these shifts and the signals of safety they're sending to themselves as opposed to how much of exercise it takes for an Olympic athlete to run a faster sprint or something like that. Have you noticed anything like that in their practice? Does that resonate with you?
Oh, I think absolutely it does. And I think that's what's lovely. And it is, I always tell my clients it's the next one right step. It's just
Mm-hmm.
simplifying it to what is the one next right step that you can take at this time.
Mm-hmm. I think some of them have so much negative self-talk, they've become fatalistic that they're never going to be well, and also that it would take the effort of an Olympic athlete to get well. So it's almost the need for them to let themselves accept that the body's ready to find the way back. It just needs a little support, remove a few barriers, provide a few resources, and it does amazingly well.
It's so true that reset. We talk about as an analogy to reboot your computer when it's getting slow, or your car gets an oil change to keep it functioning. Well, the body functions the same way. And by the time we see aspects of this congestion or failure or sluggishness in the blood, it's already been going on for a long time. And so routine maintenance, I give the example biblically, it says the body is the temple of our spirit, or the cathedral. Really, the word is the cathedral of our spirit. So our body is the cathedral of our spirit. And when you think of a cathedral, oh my goodness, don't you think of like Notre Dame or just some beautiful, cathedrals in the world? And then you think of, oh my gosh, that must require a lot of maintenance to keep that strong and healthy. And oh my goodness, it needs a strong foundation and constant renovation. That is so true with our bodies. Every aspect, constant renovation, constant, cleaning, um, constant prayer too is part of my philosophy as well.
Mm. And I like it also that because you're talking about a sacred space, then I think the reason we would do those loving endeavors is out of loving engagement. So then I think people are coming out of rest and digest, rest and restore mode, heal mode, not I should, I must, I have to. people feel like I have to do the dishes, I have to clean my room. It's inherently sort of, it's just another should on the should list.
Right. Right.
So you've got all these resources around the non-prescriptive aspects. Perhaps let's set out to do two things between now and the end of the interview today. Would you share with us what you think is most important in lifestyle? For example, I saw you talking with Dr. Perlmutter about your MenuPause book and different foods for different dimensions of that part of a woman's journey. Should we talk about food? Should we talk about stress? What would you say is most important for women right now around this blue zone aspect you invoked around, our bodies knowing the way independent of supplements and medication?
Yes, independent of supplements and medication, it is the positive attitude, is how we speak to ourselves more than ever. And the self-criticism, the self-condemnation, the guilt, the shame, it's terrible how we speak to ourselves. And so like first is, I always say, focus on a daily end of day practice. And before I wake up in the morning, I do this practice. Where did I see love yesterday or today? Where did I see love? Where was there laughter, or could I have laughed more? Like not taking myself so seriously. And that list is usually a long one. And then what am I grateful for? And those three things, like where did I see love? Connecting with you today and your audience, that is a sense of love and connection. And I do it with so much gratitude too, to be able to have this time. I learn as much from you as you do from me. And that for me is something I will remember at the end of today and be grateful for this time. And so those are things that I say that increases oxytocin and lowers cortisol. So if I'm going to work on the most powerful hormone in our body, man and women, I'm going to focus on that hormone oxytocin, get you to increase more oxytocin, to feel more joy, despite the chaos going around us, despite the chaos we may be dealing with. And that is a practice that I teach first and foremost, is focusing on increasing oxytocin in fun, loving, playful ways. And then it would be in looking at how we improve our body's hormonal status as we're aging. And this is something, really, it just clicked for me not too long ago. I always show, okay, with progesterone decline, 35 to 55, there's an increase in all the neuroendocrine symptoms, the anxiety, the difficulty sleeping, the hot flashes, the mood swings, the waking up in the middle of the night, right? The loss of energy. So a lot of those, are neurotransmitter functions, right? So what is that having to do with our, with our with our hormonal balance and menopause? Well, the big aha for me was that if you look at the chain to, that help, like if I always say, if I can get someone to sleep, I can take 10 years off their life, right? I can give them 10 more years, I should say. I have them age backwards is another way. So either age backwards or give them 10 more years. But anyway, it is like, getting a good night's sleep is so restorative. So melatonin is responsible for a good night's sleep. Melatonin secreted by the pineal gland. When we look at that pathway to make melatonin, tryptophan to 5-hydroxytryptophan to serotonin, and to serotonin to melatonin. So we know that estrogen, one of our hormones, a hormone in women and a hormone in men, but estrogen is responsible for keeping serotonin at healthy levels. When estrogen levels drop, serotonin levels drop. So what typically happens, low serotonin, and often first symptom is anxiety, irritability, worsening PMS, and in comes the prescriber's SSRI. Here's your Prozac, here's your Zoloft. Well, that is designed to block those receptor sites so your body thinks there's more serotonin, has done nothing to make more serotonin. Well, okay, let's go up a chain. We need to make more serotonin, so we need more 5-hydroxytryptophan or more tryptophan, famous for our turkey dinners. You think of turkey dinners, think of tryptophan. Turkey is high in tryptophan, will put you right to sleep, right? So tryptophan converts to 5-hydroxy to serotonin. Well, what does tryptophan need? When tryptophan needs healthy levels of progesterone. Such an aha moment for me. When progesterone levels start to decline, tryptophan degrades. So you have less precursor to make serotonin. And that was and so less serotonin, less melatonin, less sleep, anxiety, sleeplessness, and then you're in this downward spiral. But I'm always like, okay, what do we need to make more? How do we fix the smallest point that's going to have the best results? What's the smallest thing I can do to make the best results? So optimizing progesterone, since, with our supporting our adrenal glands, supporting ovarian function, decreasing cortisol, because progesterone will be siphoned down that cortisol pathway. So those are things that will increase progesterone. And then make more tryptophan. Eat more tryptophan containing foods, supplement with 5-hydroxytryptophan and vitamin B6. I would add in some magnesium rich foods and or magnesium supplements as well, and methylators. And those cofactors help those conversions in a very healthy way. So that is basically very, that's like very basic foundational stuff that gets to the bigger problems. And then we're sleeping better. We're making more melatonin. We have more restorative sleep. Our body's repairing on its own. It's a beautiful thing. Versus here, just take an antidepressant.
Yeah.
Here, take a sleep medication. Do you see how the thinking is so wrong?
Yeah. Someone I find that because I'm both conventionally trained and functional medicine certified, I feel like I have a little room to be critical of the conventional medical community because I'm part of it. And the conventional docs are often the last ones to the party, and our patients seem to get it right away because most of the people I establish with, they're ready to go. They say, I want root cause medicine, which to them is commonsensical. I think it's a lovely aspect of our patients who are curious about and fascinated by functional medicine is the deeper dimensions of things. They wouldn't, I don't know, they wouldn't drive around with duct tape on their windshield if they could replace their windshield. They want to get what's going on and do something about it. I think some of our audience will probably rewind what you just shared and take some notes on just that. And it's a great vignette for how people can explore your work, explore your books, explore your podcasts, and go down into these deeper dimensions of root causes. What about what does our audience need to know about food? Are there specifics about food in women's health that are underappreciated, even in people who love whole food?
Specifics about food, yes, and especially in perimenopause and menopause, that's where my KetoGreen approach comes in. It's that, we need fats to make our hormones, and sacrificing fat sacrifices our hormones. So those of you, like I was in high school and college in the 80s, and we were in that full-on low-fat movement. I was so careful about what I ate, and especially with strong family history of diabetes and heart disease. But that low fat movement basically destroyed my metabolism and destroyed hormones for generations of women. And so getting women to really add the fat back in and not be afraid of it, like to have some good butter and ghee and to enjoy a good steak or salmon. I mean, don't be afraid. Don't be afraid. Avocado oil, smoked salmon. Some of my favorite thing, you being up in Alaska. I don't know if you go, do you ever go the salmon fishing? Oh my gosh, that is on my bucket list, Robert. That is on my bucket list.
Well, we have a guest room that doesn't get occupied enough, and that's actually a sincere offer. So
I will take you up on it. I will. It is such a bucket list item for me. And I just I want to see that. I want to experience that. So, but things like that are just so nourishing for our hormones and low inflammatory foods. So in my books, I incorporate spices and really they're medicinal spices and medicinal recipes that are designed to decrease inflammation and support your hormones. I've put a lot of thought and testing into it, including wearing a continuous glucose monitor to make sure that blood sugar stays really stable with these meals. So, Yeah, so it's really that's the fun piece, and then greens, the alkalinizers, and this is what I learned from when early 2014 I really started, digging into keto, and then recognized that wow, it just threw me for a loop. I felt keto crazy, keto psychotic, maybe, I don't know. But I recognized that it was so acidic from that keto diet and my lifestyle at that time. That I was so acidic that my urine pH was as low as the pH paper read. So David Perlmutter said to me, he's like, "So you were peeing acid, Anna?" I was like, "Yes, I was peeing acid." And and so it was just an aha moment when I had that really low urine pH. I was like, okay, I have to add the alkalinizers. And then people would say, oh, well, look at the Inuits in Alaska. They don't have greens and vegetables, but they have bone broth. They got their minerals from their bone broth, fish bone broth, and throwing everything in there. And there's so much protein, so many minerals. Those are your alkalinizers. Now, 8 years later, the keto world and fasting world is like, oh, get those electrolytes in, get those electrolytes in. And that's a piece of it. But without the fiber feeding the gut microbiome to help with estrogen detoxification, then we're missing a piece of it. But it's also to see what's happening in your body physiologically as a result of your mindset and your nutrition. And I think that's where I have clients check urine pH and check to see if they're in ketones. And now I added on uric acid to our urine test strips, because fasting too much is going to put you in that high uric acid state. So
I think what you're sharing is so important, in that a lot of what thought leaders like you are defining is some of these big swings in therapeutic whole food plans, uh, some of these ends of the oscillation around keto or ultra high fat, etc. We need thought leaders like you pulling it together into a sensible, high yield place. And it really takes me back to the father of functional medicine, Dr. Jeff Bland, saying the right amount in the right place at the right time. It's a convergence then of these mission critical things that are really important. So uh, thank you for that, and I encourage people to check out your resources.
yeah, and then my most recent book was MenuPause.
MenuPause, yeah,
Yeah.
yeah,
I always
perfect.
joke, Rob, I'm like, the next book is going to be about the menu pause. But anyway, Menu Pause is a fun book with 5 different recipe plans, 5 different 6-day menu plans that each pause something different, because we do get stuck in a rut sometimes. And so changing that up makes a big difference. Not getting stuck in your keto, in your paleo, in your vegan, but to really to look at all sides, to
Mm,
experience, all
mm,
dimensions, and give your body a break from what you're doing. Change it up.
mm. Um, One thing you invoked that I think is so important, if we could briefly hear from you about this. We've talked about this negative self-talk, and then one of the great insights of the age you and I practice in is the importance of recognizing trauma and just what we've all been through and hardship. What do you have to share with our listeners about how to engage that meaningfully as part of our overall health? Because it sounds like it's part of your message to women
Oh my
who are
gosh, it is.
reversing their self-talk, self-compassion, etc.
It is such a big. It's such a big part of it. It's where do we start with that? But for me, it is when we think about trauma and what every, in our life, I would say the menopausal woman has been through some shit, right? By the time we get to this age, we've had heartbreak, we've had loss, we've had betrayal, we've had some type of trauma in our life often. Um, and so, what I've learned coming from a place of, deep, dark, painful trauma is that, what really helps me and what I teach to help my patients is to be in the present moment, to be grateful for everything in your present moment, and to shift your thoughts to the positives in your life, to keep focusing on the positives. When things are, crashing around us, and right now there's the Palestinian-Israeli conflict that is just horrendous, and a crisis for humanity, and to compartmentalize, to be able to do what we can to and to compartmentalize so it doesn't consume the day in, day out. And I say this from a place of love and a place of practice. I know as a mom, I want to take care of my family. I want to take care of my children. I'm half Palestinian. I have family in Israel. And so during this traumatic time, it's how do we show up lovingly, kind, and honoring all lives as honorable. There's no lesser human. We say this, my daughter's a human rights major, and she likes to say there's no lesser vulva. So there's no lesser human. There really isn't. And so we honor that. And now to practice that, being pulled to the angles of our humanity, and especially now. And so this concept of empowering love, sending a message of love, sending a message of peace, sending a message of kindness, starts with our microcosm, right? It starts with us in our personal lives, in our body, and then from our body to our family, to our community, to the world. And so focusing on what we are doing as an individual, focusing on the highest vibrations of love versus the lowest vibrations of hate and fear, then we are sending a message. We are sending a vibration. We are energy, and we are all connected, and we are all connected to a universal one. So if we are able to raise that vibration, we bring others along with us. And it's hard. It's hard when there's fear, when there's trauma, when we are triggered by past trauma, generational trauma. When we are triggered with these things, it comes down to, in the present moment, what do I know to be true? Where do I see love? Where is there laughter? Where can I be grateful? And I focus on those things. And that's the angle that I am striving to practice, to be in, to practice, and to share from, so that I can help others and continue to help others. That is my goal, to empower others to love themselves, love their lives, love each other, have the best relationships. The blue zones have community, have loving relationships. They have each other's back. We want to create a blue world. That's what we want. So that's the piece that I'm coming from.
So moving. Moved my heart, made my day. Some women who are gonna do all the things, engage all the things you talked about, they're gonna have one last thing they've got to decide. They're gonna have to decide. They undertake the lifestyle, if they do the mental, emotional, spiritual work, if they work with somebody who's gifted with the supplements and the prescriber's pen, they're gonna have to ask themselves, is this decision to potentially use estrogen or progesterone, is this going to potentially impact my breast cancer risk?
Oh, such a good question.
Would you be willing to wrap up and illuminate that for women so they can make a good, solid decision and have that agency empowerment in that domain also?
Oh my gosh. And the part of everything that I've done and created in my life is to help my patients with breast cancer that were left to nothing. Over the 1999, first patient that I treated for breast cancer came into my office. She'd had a history of diagnosis, and she was told she couldn't have any hormone therapy, no vaginal hormones, 63-year-old woman. And she said, I'd rather die than live this way. I'm a woman of the 60s. I love my husband. It hurts to have sex with him. I'd rather die than live this way. Help me, doctor. And she brought research to me on testosterone and DHEA. She was a researcher, a head, very intimidating woman, may I add. I was like, I better find the answer to this one. And so, I was a researcher, a research scientist before I went to med school. And so I dug into the research, and DHEA, testosterone, even topical estrogen are safe in patients with breast cancer. So we want to create bodies that are inhospitable to cancer. It's not the estrogen that caused the cancer, right? It's not the estrogen that caused the cancer. It's the estrogen disruptors, the endocrine disruptors, the hormone mimickers, the inflammation that cause the disruption to begin with. And those, patients that I balance with bioidentical hormones never, thank God, had a diagnosis of breast cancer. And so, but however, I diagnosed several coming in, either not on hormones or on synthetic hormones. So that is an important thing. And then using one of the products I created, Julva, is DHEA and plant stem cells from the alpine rose that help recondition the pelvic vaginal floor. There's great research in our breast cancer patients that says it's completely safe. So creating a way that people can feel empowered if their doctor's not comfortable writing a compounded vaginal hormone formula, if they're not able to get these prescriptions, there are over-the-counter options. The Julva cream that I created, the Balance cream that I created, and that's part of creating, again, a body inhospitable to cancer. So no one should be denied. And that's the same thing. Topical hormones, the safest route. We need to see where those hormones are going. If you're currently undergoing therapy with tamoxifen for breast cancer, we wait till it's done. With permission of your doctor, we could use topical DHEA. They typically won't do topical estrogen. So we could use Julva with the permission of your oncologist. You have to ask. And then we want to look at your estrogen metabolites. We want to make sure your vitamin D is high. But I can't tell you, Rob, how many patients came in with breast cancer diagnosis and their vitamin Ds were in the teens. And that just breaks my heart. They're getting all this therapy, they've had chemo, they're on the anti-estrogen drugs, and their vitamin D is in the teens. And so, it's got to be up by 60 to 80 in my breast cancer patients. And I'm doing you a lot of good by doing that. And so it's a travesty when I see things like that, not measuring vitamins and minerals, not measuring estrogen detoxification pathways. Looking at that needs to be part of the routine care. And so making that available and that information available to patients is part of my passion too.
Well, you're bringing a lot of light today, Dr. Anna.
Thank you.
Thanks a million. Tuck it in your mental notebook that the last week of July is the time to be in Alaska for sockeye salmon, and that guest room is really available.
Okay, that is my birthday week. So,
and for everyone out there, thanks again for joining us. And where can people find you, Dr. Anna?
So easy to be found at dranna.com, so DRANNA.com, and on social media at The Girlfriend Doctor. And I definitely welcome all of you to join me and join my list too. We do a welcome call for newcomers periodically. So it's a nice opportunity to get some one-on-one time with me too, or a few to one time. Yeah.
Have a great day.
Thank you, you too.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.